Okay, so I am now firing up Infirmary to really show some of the advanced features of the cardiac profile. So we've looked at all of the different profiles as far as respiratory, advanced hemodynamics, the cardiac rhythms. There are many cardiac rhythms, and these do show up on a 12-lead EKG across all the different leads with modeling the actual views for what they would be in different leads. So, for example, if I fire up monomorphic VTAC and then apply the changes and scroll this window off the screen, you'll see that first off, the cardiac rhythm is applied to the patient model, and the rhythm does look differently depending on what lead you are looking at. So if I show the grid to make it a little brighter and easier to see, and then pause, you can see that all the different leads of the 12-lead EKG do uniquely show how a 12-lead EKG would be. And the progression of the waveforms across each lead is modeled after real life EKGs. So for example, the QRS amplitude progression as we go from V1, V2, V3 to V4, V5, and V6, we have maximal impulse or maximal amplitude of the QRS complex on leads V2 and V3, mainly V3, and it really starts to diminish on V4, V5, and down to V6, as you would with a real life EKG. So the labels for the EKGs are in the top right of each box. The actual boxes are not drawn for each lead, but you can see V4 is where my mouse is hovering now, V5 is where my mouse is hovering now V6. So when I go to change some of the cardiac, for example, ST segments, so increase leads 2, 3, and AVL, just pick some. And when I unpause the device, those changes that I made to the patient model are going to draw across the EKG. And so as the EKG is running, obviously in VTAC, that's not going to be an ideal way to show, or an ideal rhythm to show that in. We can change the patient's rhythm. So I just changed it to a sinus rhythm, and I'm now re-implementing those ST elevations. So you can see that changing rhythms, first off, is very smooth and natural. Changes to the patient model, the underlying digital simulated patient model, happens according to the cardiac cycle. So when you change a patient's cardiac rhythm, it does change on the next heartbeat. Of course, if there is no cardiac cycle or if the cardiac cycle is extremely slow, I do have a backup timer that kicks those changes in after about 5 to 10 seconds. So, but otherwise, cardiac modeling is relatively natural when it comes to using the cardiac cycle and modeling that appropriately. So I've made some increases to leads to ST elevation and leads 2, 3, and AVL. They're a little blocky, those changes, but you can see that there are those increases to the ST segments in 2, 3, and AVL. There's also the ability to set QRS interval and QTC interval. So if you want to model different types of QRS morphology, you can adjust the QRS interval. And for example, I'm going to start to make a wide complex with a very long QTC interval, and it's going to start drawing from the right side of the screen. In fact, it is possible to adjust uh, the cardiac parameters so much that they look unrealistic and that the drawings do fall into an unrealistic territory. So I'm going to back down on the QTC interval, and it should start to draw a much more realistic waveform. There we go. So as you can see now, if I pause the device, I have a wide complex which I've set my QRS interval to 0.24, and I have a QTC of 0.48. So we see now both the elongated QRS and the QTC, although it doesn't look horribly elongated, uh, that is calculated alongside the QRS interval. So we actually do see the T wave about to fall on the P wave. So it is possible to model different QRS morphologies, ST wave morphologies, T wave, by using the T wave elevation, by taking it into negative numbers, you can set T wave depression or flipping of the T wave. It is possible to do all of that with Infirmary and then model it across all 12 leads of the EKG. And lastly, you can even do that modeling with different cardiac axes, such as a right cardiac axis that I'm now applying, and it will change as you cross the different leads. We can change the cardiac rhythm in the middle of this. For example, I can switch it to a sick sinus syndrome while retaining, actually it did reset some of the wide QRS complexes and the QTC intervals, but we can mix all of that, see how Infirmary draws it, and then you can set up a scenario or do a screenshot of a tracing and print it out, um, however the morphology you'd like to set up. So it's drawing a bit unrealistically with the tachycardia and the short QTC. But like I said, you can make different adjustments to all the different cardiac parameters and then see how it traces out so that you can prepare your educational materials or your live scenario, your simulation accordingly.